Drug abuse affects not just the person, but their family and the community. But street drug use is not the whole picture. Dr. Geoffrey Phillips of St. Joseph Hospital in Orange tells us about the range of this nationwide problem.
It's a broad category. There are multiple agents of abuse or methods of abuse. It's a worldwide problem. It's something that affects our schools, our work, our legal, our border, our laws, certainly our health care. The cost of trying to evaluate and treat drugs of abuse are in the hundreds of billions.
We asked Dr. Phillips what he sees in his practice.
Yeah, my practice, my outpatient practice, my inpatient practice here, where do I see drugs? It's such a broad topic. It comes at me from individuals abusing pain meds. Many times it's a repetitive story of, I had a knee surgery, doctor started me on a medication, didn't help, I started a second one, I didn't stop the first one, I ended up on 2 of them. Ultimately built a tolerance to it and needed more and more of the medications. I saw 2 doctors, 3 doctors, was receiving medications from all of them, and I'm taking all of them. At that point they come to me on 15, 20 tabs a day when they should have been on 2 or 3, or should have worked to the point of coming off those meds. They also end up in the emergency room or in the hospital setting, outright abusing heroin or cocaine or methamphetamines. In this area, methamphetamines is one of the more common drugs of abuse. I would love to say that it's a very high success rate. It's not. It's always been a struggle for medical profession to identify and successfully treat drugs and drug abuse and drug addiction. For those that have the means to treat themselves, there are a lot of programs, and the sky's the limit as far as how much you want to afford to try to treat this. And then many family members will come through and contribute oftentimes to help someone to get clean and stay clean. And sometimes that's an important factor because they know what their family has gone through, how much commitment they've put out to get them healthy and clean again, and that may keep them from using it. They don't want to see their grandmother who helped them suffer again like that. For those that don't have the means or don't have the resources, I mean, one of the most inexpensive, no cost really, means of aid is the 12-step programs, AA or NA or Celebrate Recovery, which is a Christian-based program. There's no cost to an individual to enter those programs, and those programs walk you through steps of admitting what you're facing, accepting the illness and the lack of control in the behavior, and working as a group and as an individual to stay clean and continue your success. So we do try to impact them from all fronts, from trying to replace some of their physical or their perceived need for the medications, changing their environment, getting them into a group setting like a 12-step program or something in which they find new avenues, new support, new friends, which may help their success rate significantly. But there's no doubt that we don't replace the drug itself, ideally, and that there are reasons for which they go back to it. Unfortunately, at that point, their insight is clouded to the point they don't remember what happened to them. They don't see it coming again, and they get hit by the same truck that they ran into the first time.